Hi, my name is Beth, and I am in the Psych NP program here at Eastern Kentucky University, and I did my project on major depressive disorder. Depression affects so many people. I have been a psych nurse for 13 years, and this is something that I see probably every day is people have depression for whatever stressor that they may have. But here's a few statistics. In 2018, 17.7 million adults met the criteria for major depressive disorder. And as I was going through my research, one thing that I did notice is all of my studies are based on the DSM-4, even though they were all within 5 years. So they are not using the most current DSM that is out there, the DSM-5. But as of these studies, however, it is for these statistics, it is for the most updated DSM-5. And of those adults, over half will seek treatment. I had 3 research studies, a level 1, a level 2, and a level 6 for my project. Level 1 was a meta-analysis to find out if CBT is actually effective in major depressive disorder and relapse versus treatment as usual. And treatment as usual can be medication, it can be other forms of psychotherapy, that sort of thing. A systematic review was completed of 16 trials containing 1,945 participants age 18 and over. It ended up having a favorable patient outcome because it reduced the relapse rate by over 50% throughout a 12-month time span. Level 2 was a randomized controlled trial to investigate the effectiveness of CBT on depression versus general health education. And in that study, general health education was things such as diet, exercise, sleep, why that stuff's important. Participants included 57, and they had either mild depression or major depression. And the data was obtained using the Hamilton Depression Rating Scale 17 or the HDRS 17. Compared to general health education, the groups who received CBT showed significantly higher improvement on that rating scale. And the level 6 was a qualitative research obtained from only 6 participants who were part of a larger random controlled trial. Out of the 6 participants, 3 had received CBT and the other 3 received MCT. And of those 3 that had received CBT, they reported more positive thought patterns, personal strength, and higher self-confidence, and 5 themes were identified. And that was, those improvements were seen more for CBT, showing a favorable CBT outcome over MCT. A couple limitations did take place. However, the level 1 did not have data prior to the 12-month follow-up and had data from a variety of environmental settings. Furthermore, it failed to show previous interventions that may have occurred. And the level 2 and 6 had small sample sizes and did not take into account any psychopharmacology interventions that may have been concurrent with the CBT. Moving on to the next slide. As I said, all 3 levels of research determined CBT to be effective in treating and preventing relapse of depression and depressive symptoms compared to the control groups. It is a highly feasible treatment option with no risk of harm to the patient. CBT can be used alone or in conjunction to other treatments such as medications. And part of that too is for medications, some people can see effects 2 to 4 to 6 weeks depending on the medication improvement. CBT is meant to be a long-term treatment option, which I will talk about further here in just a moment. And because of all of those reasons just listed, it should be used. Evidence-based research is important because it helps us stay up to date on latest research to continue to have positive patient outcomes that are evidence-based. And the evidence-based research will help us to not only find the best treatment options, but will help us educate the patients. I did use the theoretical framework called the Tidal Model of Mental Health Nursing. It was created by Dr. Phil Barker, and it emphasizes people helping to reclaim their story of mental distress, and it has created a 12-question security plan, such as: how do you feel right now? Do you feel safe? What are the chances you will harm yourself? And how confident are you that you will keep yourself safe until I see you again? And those are all great questions to ask patients as they come in, and as psych NPs that we will help assess our patients. So my PICO question is: in adults diagnosed with major depressive disorder, how does cognitive behavioral therapy compared to treatment as usual affect depressive symptoms within a 3-month time span? And it is a time commitment, as mentioned, and it may be something that is not appropriate for every psych NP to complete. The environment for which CBT should be conducted is the outpatient environment, because it typically is 12 weeks at a time for 1 hour a week. So to have the most positive patient outcome, that is when CBT should occur, as an outpatient. And that concludes my study, so thank you very much.